Cecilia Chung is the president of the U.S. Caucus of People Living with HIV organizations. She's also the board chair of the SARO Project. She's an immigrant from Hong Kong, a senior strategist at the Transgender Law Center, and health commissioner in San Francisco. She's a nationally recognized civil rights leader who advocates for HIV awareness and care, LGBT equality, and social justice. Welcome, Cecilia.
Hi, thank you for inviting me to participate in this very interesting discussion. And from my perspective, I didn't really prepare quite well for this because I was asked to do this since yesterday, so I'm going to try to do my best. And I think that sex and science is a very great area when it comes to transgender people. How many of you actually study comprehensive sex education that mention transgender people in your school? 1, 2, 3. Hey, so I rest my case. And so when it comes to talking about sex, when it comes to talk about HIV prevention with transgender people, for the longest time we have been conflating that with MSM sex and issues, and which is number one, a very discouraging ways to trying to engage transgender, especially transgender women, into HIV testing and care. And therefore, a lot of transgender women choose not to get tested and choose to defer care because they could not find a trans-competent HIV providers or HIV testing site or a care providers. And that's pretty much universal around the globe. And I want to focus a little bit more on where I came from. I am from San Francisco. It's a really wonderful city because we have near universal health care provided by the Department of Public Health. So anyone who has no insurance, who have low income could come to our public health clinics to access treatment, including transition-related care as well as HIV services. But in such a wonderful, resource-rich, high-income city, we still have challenges. A recent study done in San Francisco looking at the treatment cascade of transgender women found that transgender women are less likely to have a good survival probability, 5-year survival probability compared to men and women who are living with HIV. And in addition, during the studies, they found out that 95% of the transgender women who are HIV positive already knew the status. 77% of them linked to care within 3 months, and almost 87% of them access care within 6 months. And out of that group, only 65% were currently on ART, and even more alarmingly, only 40% achieved viral load suppression. That tells us that treatment is not always the priority in a transgender woman's life. And when we talk about protection, treatment, oftentimes we're talking about same thing, right? Condoms, like negotiating safety, and and recently, we have this whole discussions about PrEP and PEP. That's a caveat to it. Another caveat to that was during the IPAC study, which is the largest PrEP studies, they did try to recruit transgender women into the studies, but most of the transgender women that was recruited into the study dropped out because they didn't feel like the providers or the researchers were affirming who they are, and instead they felt like they were being treated as MSM. And that's usually a very typical responses in any clinical research that we have. And when you call up for clinical research, they will ask you, are you men or women? And when you tell them that you are trans, they would explain to you that you'll be like grouped into the group that you might not necessarily desire, and sometimes because you're taking hormones that actually rule you out from this clinical research. So we actually don't have any really empirical evidence. Technically, we know that it will work, but we don't have proof that it will, because we were never one of the focus priorities, and yet we're being called the key population. Irony, irony, irony. And so with that, we also have to talk about pleasure. I think that it's all about pleasure here. And it's not easy to talk about pleasure when you have this nagging anxiety in the back of your head and say, how do I disclose? Do I disclose that I'm trans woman first, or do I disclose I'm HIV positive first? And then on top of that, most of the times we find this to be a very objectifying experience, that we are not being treated the way we want to. And so when it comes to sex, our priority is find a partner that is affirming our gender. So let's not even talk about safety, because it's hard to come by. So the treatment cascade study in San Francisco actually kind of confirmed that trans women with more than one partner are less likely to engage in risk activities compared to those who only have one partner, because most of us do interpret unprotected sex as a form of intimacy. Otherwise we wouldn't call condoms a barrier with it. Yeah, we will call that a protection. And also the other piece of this that is missing here is, how do we empower our own community to feel free to talk about sex in not a shaming or stigmatizing way? And and I didn't learn that from my parents. I don't know about you. Do your parents teach you how to put a penis into the anus or vagina? Anyone? Oh, well. So, and that's my other point here, is if we actually feel the self-worth, feel that we need to take care of our body, we would not be afraid to ask our partner their status first. And we don't have to wait for somebody to disclose. So, and I'm gonna stop here and allow my colleagues here to continue.